Well, GAD stands for a term General Anxiety Disorder, and it's a very interesting condition that for many, many years people were presenting with symptoms that seemed a little bit like depression but were not depression. In other words, people were complaining of feeling very anxious all the time. They were complaining of a constant sense of foreboding. That's probably the critical thing. A constant sense of dread or foreboding that something terrible was going to happen. And that was usually associated with a whole pile of different physical symptoms. Very commonly, people with GAD feel a lot of tiredness, fatigue a lot of the time. They struggle a bit with concentration. They find, for example, that they're not sleeping very well, that they're maybe grinding their teeth at night, and very, very anxious at night, grinding their teeth. They might find that they're getting a lot of acute anxiety symptoms, like irritable bowel. They might be finding that they're all the time feeling their muscles very tense. Sometimes they may feel slightly panicky feelings in certain situations, but not like in a panic attack. Panicky feelings maybe like their heart going a bit quicker, breathing a little faster. A lot of people with general anxiety disorder find themselves sighing all the time. It's almost as if they'll often tell you they can't take a big enough breath. So they kind of live in this world where they're living this almost in a turned up state of tension all the time. And there's a wonderful term for it, we call it tired but wired. It affects women, by the way, 2-to-1, much more commonly than men. And it's actually a condition which has been present for many, many years, but which you're only now beginning to recognize as a genuine mental health issue. And it really caused a lot of distress to the people who suffer from it. And it's totally hidden. And many, many people, I describe them as like ducks floating on the water. They seem very serene, flowing across the lake, but underneath they're paddling like hell to keep going. So it can be a very, very tough condition for people because they don't want anybody else to know about it, and yet they're suffering from it all the time. A very nice way of looking at general anxiety disorder. Can you imagine if you had your central heating on at home and you turned up the thermostat, you turned up the dial? Well, that's kind of what's going on both in the brain and the body. What's going on in the brain, parts of our brain called the prefrontal cortex are spending an awful lot of time catastrophizing, visualizing all the potential things that could go wrong. And since this part of the brain has a straight link to your amygdala, and your amygdala is in charge of your stress system, so its job is to see danger. So the amygdala fires, and if it fires in an acute sense, it releases adrenaline, but if it fires in a more persistent sense, it leads to the adrenal gland releasing cortisol. And it's the cortisol that leads to all the symptoms. Glucocortisol leads to all these symptoms of tiredness, difficulty concentration, sleep difficulties, and almost leads to this chronic low-grade fatigue all the time. And so it's what's going on in the body is these hormones are being released on a consistent basis because my brain is in a state of hyperactivity. Do you know what I mean? My amygdala is slightly overactive, my prefrontal cortex is slightly overactive, but it's this catastrophizing that's at the heart of it. So the physical symptoms are being produced by the amygdala firing, and the psychological symptoms are being produced by the prefrontal cortex firing inappropriately or misrepresenting things. It's a very interesting one. For many, many years, people wondered, was it genetic or was it environmental? And for example, we know that certain children are born anxious. From the very second they're born, they actually have lots of the signs of being slightly withdrawn, slightly on edge. So it's almost as if a certain percentage of the population have a predisposition genetically to be anxious. But we know that there's an incredibly powerful, what we call epigenetic. I discussed this in Flagging the Therapy. An epigenetic means that the ability of the environment to switch our genes on or off. So I grew up in a very calm, quiet house where there's no stress or no anxiety going on. Well, in that house, those genes will be modified, and I will probably grow up not to suffer from general anxiety disorder. But suppose I come up in a house where maybe the mum or dad are extremely anxious or all the time worrying all the time, then that causes these genes to switch on in a major way, and then I end up kind of like my mother or like my father. And many, many people who suffer from general anxiety would say, well, my mum was a constant worrier or my dad was a constant worrier. So they can actually identify themselves growing up in this household. So what actually happens by the time we reach adulthood, these genes are switched on. So now we're inclined to be constantly anxious all the time. And the trouble is, the modern world is so full of stress that there's almost a continuous stream of stressors to keep firing this anxiety. So we kind of go from one mess to the next mess, constantly worrying, constantly foreboding, constantly anxious. And of course it leads to exhaustion all the time. And many women really struggle with this, And there's a greater incidence of panic attacks because of this general anxiety, because my amygdala is very irritable, so it's more likely to fire panic attacks. It's behaviour that actually causes the difficulties a lot of the time. For example, one of the commonest dangers, particularly in women, is to use alcohol to try and calm things down. So for example, the wine epidemic amongst many women is felt by the addiction counsellors to be very regularly a sign of people using alcohol to cope with general anxiety. So wine being particularly a problem. Another big one was that unfortunately many people ended up using tranquilizers to try to calm the anxiety, because they were very effective. As the saying goes, they do calm the amygdala down. But the problem with tranquilizers is they stop the amygdala from relearning. So if you're on tranquilizers, then talk therapy or trying to challenge your amygdala in other ways is not as effective. So in fact, in order to get rid of it, you really have to try to get off all these things and try and tackle the anxiety at a CBT level. Some people have also ended up on maybe antidepressants, which have been shown to be some help in some cases of severe general anxiety. And some people, they are actually of use. But some people end up with these for long periods of time, not necessarily really for the best reasons. And in many cases, some CBT would be far more effective. Other people may end up spending huge amounts of time on Dr. Google. Dr. Google is the greatest disaster in the world in terms of anxiety, because if you type in 5 symptoms, I could get them to produce about 100 different conditions, all of which would be fatal. Another big facet of general anxiety disorder is that people procrastinate in making decisions. So they're afraid to start a job in case they don't do it perfectly. So they don't start at all. So everything starts building up, and then everything comes on top of people, and then they get even more anxious. So it's our behaviours when we're generally anxious, and I describe this a lot in flagging anxiety and panic as to how best to challenge these. I've always believed that we have to look at it holistically. For example, I've done this in a number of books. So we must look at exercise. Exercise is a wonderful way of reducing anxiety. So 30 minutes of brisk exercise every day. Mindfulness is a very helpful thing to do. So to do an 8-week mindfulness course is extremely helpful to do. Try to avoid medication if at all possible. Try to avoid going to Dr. Google. Try and avoid using alcohol as a crutch. But the real trick is to try to get some CBT help, some cognitive behavioural help. And what we try to do in cognitive behavioural therapy, we take on the prefrontal cortex catastrophizing. We begin to use little cameos where we teach the person, what's actually happening to them when they're anxious about something. Because in CBT, it's not about what happens to us, it's about our interpretation of that event and our behaviours as a result of that. So we teach people how to change their thinking and how to change their behaviour. And this is an extraordinarily effective way of calming down your prefrontal cortex and calming down your amygdala. It's also very important as well to teach people to learn that the physical symptoms of general anxiety disorder are very often being created by the amygdala, and that the amygdala will only respond to a very small number of treatments, of which accepting the conditions as uncomfortable but not dangerous is one of the biggest. And also we know that it responds very well to exercise and some mindfulness. So these therapies are very helpful in terms of calming down the amygdala, and then calming down your catastrophizing. The right prefrontal cortex is, I call it in flagging anxiety and panic, the catastrophizer. And this is the guy that's causing all the problems. So you need certain kind of skills to learn how to deal with that. And I lay all these out in that book to try and help people. But the great news for people is that doing some consistent, regular work using CBT principles can rapidly turn around a lot of your physical symptoms in general anxiety and make your life much more meaningful.